Hey guys, so in this session I will discuss about an important topic from your exam point of view, which is your pharyngeal arteries. So I will try to make this topic simple in this session, and we will discuss it with the help of a diagram, and we will discuss all the pharyngeal arch arteries, pharyngeal arch and its tributaries, right? So I hope you will keep your focus in the screen, and we will discuss it in a simple manner, right? So I am starting with the illustration. Just focus in the screen, right? So now this is your right dorsal aorta, right? And this is your left dorsal aorta. Right dorsal aorta, left dorsal aorta, correct? So from here I will draw 6 lines. One second. Correct. So as you can see, these are 6 lines. So we can say this is a first arch, this is your second, this is your third, this is your fourth, and this is your fifth, this is your sixth. As you know, there is no fifth arch because fifth arch usually regresses, right? So there are 5 arches: first, second, third, fourth, and sixth. No fifth, right? Because fifth regresses. Correct. Okay. So I think up to this it is clear, right? Now we will see the derivatives from each arches, right? So up to now we have drawn the right dorsal aorta, left dorsal aorta, and the 5 arches 1, 2, 3, 4, and 6, right? So now we will see the derivatives. Before that, correct. Okay. So I will also write here because everything I cannot show you in the image. So here I am writing few points. That if the question is like that, from first arch, what is the derivative from the first arch? So you will write it is maxillary artery, right? First arch gives maxillary artery. From second arch, stapedial artery, right? Now I will go to the third arch. So this is clear. From first arch, maxillary artery; from second arch, stapedial artery. Now we will move to the first and second is done, right? So we will move to the third arch, this one. So third arch on both sides, in the proximal part it gives common carotid artery, both side. This is your common carotid artery, and it continues as internal carotid artery, and there is an extension as external carotid artery. Similarly, right side proximal common carotid artery, distal it continues as internal carotid artery and as an extension as external carotid artery, or you can say as a branch of the it appears as a branch, right? So proximal part common carotid artery, distal part internal carotid artery, and a branch of external carotid artery, correct? So this is about your third arch on both sides. Talking about our fourth arch. The fourth arch, particularly in the left side, left fourth arch artery, it gives your ascending aorta. It's from your left fourth arch, right? Correct. Now question is, what appears from your right fourth arch artery? This is very important because right fourth arch artery gives your right subclavian artery, right? So right fourth arch artery gives your right subclavian artery. Now you may ask that then where from where left subclavian artery arises. I will show you in a bit of time. So up to now we saw from first arch artery maxillary artery is derived, from second arch artery stapedial artery is derived, right? From third arch artery proximal portion gives common carotid artery that continues as internal carotid artery, giving a branch of external carotid artery on both sides. From fourth arch artery left side it gives ascending aorta, right side right fourth arch artery gives right subclavian artery. There is no fifth because it regresses. So fifth pharyngeal arch is actually the sixth, right? That we discussed in the earlier portion. We will revise it again. So what appears from the sixth, that we will see. I will take this color. Will it show? Yes. So from sixth I will take the distal portion. Distal, from distal sixth, right? Sixth arch artery distal portion gives rise to ductus arteriosus, right? Both sides. Ductus arteriosus, sixth arch artery distal portion. Then what appears from the proximal portion? Very nice. So from proximal portion it is correct. From proximal portion it is pulmonary artery. So proximal sixth arch artery gives your correct pulmonary artery, both side, right? Now we will finish the diagram. From here something is like this. This is your truncus arteriosus, right? So from truncus arteriosus there arrives ascending aorta and pulmonary trunk, that we will see in your thorax section. So this completes your diagram. We will write the theory section now, and again we will come back to the diagram, after which everything will be clear. So I will write the theory portion now. See, so up to this you understood that first arch artery gives your maxillary artery, right? First arch artery. From second arch there arrives stapedial artery, right? Now then I told from third arch. From third arch there is proximal and distal, correct? So third arch from proximal, I told that there is common carotid artery that continues as internal carotid artery both side and gives an extension of external carotid artery. So that we will write from proximal it is common carotid artery, distal internal carotid artery. This is also clear, correct? Now from fourth arch. Now fourth arch, there is left and there is right. From left there is this is your arch of aorta, and from right it is your right subclavian artery. Correct? Then we came to the sixth arch. Sixth arch, your proximal and distal. From proximal pulmonary artery, and from distal ductus arteriosus. Now things are clear, but now I will add some complex point to it, which is also important from your exam point of view. So this I can write here only. So the question is, arch of aorta is derived from. So one, we saw that arch of aorta is derived from left fourth arch artery, which is your one, but it is also derived from left horn of aortic sac, and also from left dorsal aorta. Now where is aortic sac? This is your aortic sac above the truncus arteriosus. So from all these areas, from all these arch of aorta is derived from all these three, right? From left fourth arch artery, left horn of aortic sac, and left dorsal aorta. Correct. Now next question that has been asked. Is that right subclavian artery is derived from. So one, we know that right subclavian artery is derived from, correct, right fourth arch artery. Correct, right fourth arch artery. Also it is derived from right dorsal aorta and right seventh intersegmental artery. I will show you. Right, so right subclavian artery derived from right fourth arch artery, right dorsal aorta, right seventh intersegmental artery. Now next question that has been asked. Left subclavian artery derived from. Left seventh intersegmental artery. So right subclavian artery is derived from right seventh intersegmental, and left subclavian artery derived from left seventh intersegmental artery. Simple. Now I have already discussed that from left horn of aortic sac, arch of aorta is derived. Now what is derived from right horn of aortic sac? That was also the question. What is derived from right horn of aortic sac? The answer is correct, brachiocephalic trunk. brachiocephalic trunk. So all this has been asked before, right? So I just mentioned it with these slides that all these questions has been asked before, and we also saw the concept behind the pharyngeal arch arteries and the development, right? Okay. Now there is another important one second. Yes. So there is another important associated condition, or I can say anomalies, right, with pharyngeal arch arteries, which I am discussing now. It is dysphagia luceria. What is dysphagia luceria and how it is connected with it, right? So actually dysphagia luceria is nothing but abnormal right subclavian artery, which I discussed you just now, that right subclavian artery is derived from right fourth arch artery, right dorsal aorta, and right seventh intersegmental artery. Now when does dysphagia luceria happen? First of all, it is an abnormal condition, right, due to abnormal right subclavian artery. Now when there is abnormal right subclavian artery, when something disappears and something persists, means what is supposed to be disappeared, they remain, right? So that causes this abnormal right subclavian artery. So we'll see what all disappears and what all persists, that leads to this condition, right? So first of all, right fourth arch artery disappears. Also right dorsal aorta disappears. Then what persists? Seventh intersegmental artery persists. And right dorsal aorta caudal to seventh intersegmental artery, that also persists. And here of course the cranial part to seventh intersegmental artery disappears. So what is supposed to be there, they disappear. What is supposed to disappear remains, right? So this all leads to the abnormal right subclavian artery, leading to dysphagia luceria, right? So this is all about your pharyngeal arches and derivatives, and we will try to revise it once again. Correct. So here from here we started. So once again, this is your right dorsal aorta, right? Here is your left dorsal aorta. So I start with 6 lines as 6 arch arteries, but there are not 6 arch arteries, there are 5 arch arteries. Of them, number 5 regresses, right? So there are 5 arch arteries, number 1, number 2, number 3, number 4, and number 6. Okay. Then I told from the first arch maxillary artery develops, from second arch stapedial artery develops, from third arch proximal portion common carotid artery develops, that continuous internal carotid artery and gives an extension of external carotid artery, correct, on both sides. From fourth left arch artery, the arch of aorta develops, because arch of aorta or the heart is on the left side, correct. From the right side of the fourth arch artery, or there develops right subclavian artery, right. Fifth is gone. Okay. From sixth proximal part, there develops pulmonary artery, and distal part of the sixth arch artery gives ductus arteriosus. Finish both sides. Now for the diagram gets completed in the middle portion as aortic this one sinus, right, and truncus arteriosus giving ascending aorta and pulmonary trunk. That we will read in thorax portion. Okay, now revising here: first touch artery, maxillary artery; second touch artery gives epidural artery; third touch artery proximal portion common carotid, and distal portion internal carotid that we saw. Fourth touch artery, left fourth touch artery gives arch of aorta; right fourth touch artery gives right subclavian artery; sixth touch artery proximal gives pulmonary artery; distal gives dorsal aorta. All that we saw. Now question came that arch of aorta is derived from mainly three locations. One is left fourth touch artery, second one left horn of aortic sac, third left dorsal artery. So three locations. Then question came right subclavian artery derived from. We saw right fourth touch artery, right dorsal aorta, right seventh intersegmental artery. left subclavian artery derived from left seventh intersegmental artery, right, and right horn of aortic sac, because left horn of aortic sac gives rise to arch of aorta. Then what is derived from right horn of aortic sac? Brachiocephalic trunk. Good. Now this is an abnormal condition due to abnormal right subclavian artery. The condition is known as dysphasia luceria. Now what results in dysphasia luceria? Something that is supposed to disappear persists, and something that is supposed to persist disappears. Now these two structures disappears: right fourth touch artery, right dorsal aorta, cranial to seventh intersegmental artery. This disappears, and the structure that persists are seventh intersegmental artery and right dorsal aorta, caudal to seventh intersegmental artery. This persists. So with this you understood that seventh intersegmental artery is supposed to disappear. When this persists, this gives rise to abnormal right subclavian artery leading to dysphasia luceria. Correct? Now you can ask that where is right subclavian artery or left subclavian artery? I will mark it now in the diagram. Sixth, okay, one second. Yes, sixth is this one, correct? So here you can mark as this is your left subclavian artery and this is your right subclavian artery. So this completes your entire picture of pharyngeal arch artery. So I hope after this session you will not make mistake of any questions that is asked from this topic, right? So first I will tell you to draw and learn, right? This will make things easy. So in next session we will talk about circle of Willis, Bodman's area, right? So we will meet again in our next session, right? Thank you.